Hey, this is Charlene from Boop Baby, and I've had a couple requests to show you how to nurse in a soft structured carrier. So I'm going to show you kind of as best I can on a video how you can do that. Obviously, everybody's body type is a little bit different, so their method is going to be a little different as well. I find that it's a little hard when baby doesn't have good head control yet, so at 2 months, little Miss P is doing pretty good at that, and so we're able to nurse pretty well in a soft structured carrier. I'm pretty short torso, so what I have to do is kind of take my waistband first off and kind of lower it down. So I'm still having it on my hips. Never unbuckle a waistband while a baby's in the carrier. That's what's holding them in, so don't do that. Some people like to kind of bounce baby to one side, so that's an option too. We can kind of show you how we're going to do that. So I can kind of bounce her to one side a little bit. So she's a little off center now, but that kind of makes it easier in my opinion. With these buckles under your arm, or you'll have sometimes perfect fit adjuster straps right here that give you a little bit extra length. So I like to let those out a little bit when I'm getting baby situated. I kind of bounce them over a little bit. Then a lot of people like to use the hood when as part of nursing, so we can kind of, you can take a hood out. A hood is really good for if you want to kind of like have something covering you on the top, or a lot of people sometimes like a burp cloth if they maybe have a really overactive letdown and they're worried about that while they're in a carrier. So I've often had a burp cloth just kind of on the top of my chest. I'm wearing a V-neck shirt and I have a nursing bra that hooks and clips down, so that makes sure that you can actually get out what you need to. So with her, once I have all the straps adjusted and it out of the way, what I do is I kind of take my shirt and I'll pull my shirt down and get the breast up and out of the neckline of the shirt. You're really going to struggle doing this if you're using a carrier that, or not using a carrier, if you're using a shirt that doesn't stretch down enough. It's really hard to get your shirt all the way up and out of the carrier, so I always like to have something with a loose top. You also can do a half tank top and have the half tank top that you pull up, and so there's lots of different options for it. Let's see if she'll cooperate for me. If you're, just depending on your size, you might need to stretch the breast up to where you're going. If you're kind of busty, you might need to kind of support the breast while you're nursing. So I'm holding it with my hand, so I'm not completely hands-free. You might need to hold their head for a little bit. Some people need to hold the head, some people need to hold the breast. It'll just be what's gonna help you most. If they'll let you, you can kind of cinch up those perfect fit adjuster straps, and as you can see from the side, it's really just really easy, and even just kind of from the side, you can't, like, if you're kind of worried about what people can see, it's really nice to just have that option there. Kind of a easy way to nurse in the carrier. She appreciates it that she can have her snacks on the go, so if I wanted to, I could take this hood and I could snap it above her head up on the straps here and clip it, and that's kind of nice for giving me a little bit more of a hands-free option. This hood's a little on the smaller side than some, so she may not let me keep it on her head, but it's kind of nice. So I mean, with the hood to kind of hold and support her head, we're doing really good, and that's how one of the ways you can nurse in a soft structured carrier. So glad we could show you that. It'll be different in kind of from carrier to carrier based on what options you have for adjusting, but it's pretty similar. And then when you're done, you can put your waistband back where you want and take the hood off the baby if you've thoroughly offended them, and just go about your day. So that's I think all you need to know. If you have any questions about how to kind of troubleshoot your individual carrier, or maybe issues with your body type and nursing in a carrier, just comment and messages below, or send us a message on our Boop Baby page, and we'll be happy to help you work that out. So this is Charlene teaching you how to nurse in a carrier, and we hope you guys have a great day.